everyone, it's great to have you back today again for a very important topic. This is what I really want to discuss with you today, as it is really important. It's about non-alcoholic fatty liver disease. That is the fatty liver disease that is not coming from overconsumption of alcohol. Now, most people have a fatty liver, and they're mostly not diagnosed, but 25% of the US population is diagnosed with non-alcoholic fatty liver disease. That's a lot. But the thing is, we do not really notice anything about a fatty liver, but it can be quite serious. And therefore, we got to do something about it. And that is what I want to discuss with you today. Now, what is a fatty liver? It is what it says. It's the liver, but then really fatty. And it becomes fatty because with a normal liver function, everything that we consume, and especially the carbs and the fats, they are processed by the liver in a regular way, in a normal way. But with a dysfunction of the liver, especially the fats and the carbs, cannot be processed in a good way by the liver, because the liver in some way or another is numb to insulin, and it needs the insulin to process these substances. So the only thing that the liver can do is store it as fat exactly in the liver, because it cannot go anywhere. So then the liver gets full of fat, and therefore the liver swells, it grows. So we get a really big liver. But then when it cannot swell anymore, the fat pours out, and it goes into our belly towards other organs. Now, that is really not good news. It's not good news that this liver swells, because then the liver can tear. That's not good news. But also, when the fat reaches other organs, that is not good news. But moreover, a fatty liver goes hand in hand with many, many other of the common chronic diseases, especially metabolic syndrome. And that's the triad of obesity, diabetes 2, and high blood pressure. But also it goes hand in hand with heart diseases and irritable bowel syndrome, and a lot of other of the multiple chronic diseases. So it's really important that we do something about it. Now, how can you notice if you have a fatty liver? Well, that's the thing. The general symptoms of a fatty liver are exactly the same as the general symptoms of any other chronic disease, because these are the symptoms of systemic low-grade inflammation, like fatigue and headache, anxiety, overwhelm, depression, unexplained pains, poor digestion, cramps, bloating, irregular stools, irregular sleep, insomnia, you name it, those generic symptoms that come with all chronic diseases. So for myself, I noticed my fatty liver when I was eating a lot of fat. I'm absolutely crazy about avocados, to a certain point that I was also overweight, and I ate like 2 or 3 avocados. And then I noticed that I had some slight pains around the liver area. And well, maybe you have those feelings too. If you have pains in this area on the right side, just below the rib cage, go check with your doctor if you have a fatty liver. Like I said, it's important because there's a whole world beyond fatty liver that comes with it, right? But if you already have a diagnosis of fatty liver disease, it is important that you do something about it. So the thing is that medical doctors at this point do not have a treatment for fatty liver disease. All the research, even up to last month, the best thing that they give is with urgency telling that we have to change our lifestyle, especially for the white carbs and the fats. So the animal fats, especially. So that is the thing that we can do. What we can do ourselves. That is exactly what I did. Now, for those of you who know me a little, you've watched a couple of my videos already, you know that I help people reverse chronic disease and help people recreate their health. And we do that by a framework that has 3 basic principles that we can live by. And these 3 basic principles are equanimity, meaning a balanced mind so that we are able to respond to everything around us instead of react. The second one is temperance. That's all about our consumption. And the third one is vivacity, bringing the liveliness in our life again. Now, I've used exactly those 3 principles to reverse my fatty liver disease. They will work because these are tackling the causes of chronic diseases, all chronic diseases, including fatty liver disease. But I'm not going into those 3 principles today again. Today, I would like to talk to you about the 10 immediate things that you can do, the low-hanging fruit, specifically for a fatty liver. So you can really start right away and do 10 things for your liver. And I'm quite sure that it will help you as well. So here we go. First of all, eat half of your plate. Only half of your plate. Really, eat only 50% of what you ate today and yesterday and the day before from now on. Because the thing is that the liver has to process all the food, and the liver has a dysfunction. It cannot process all the food. Therefore, the only thing it can do is make fat. So give it less to do. Don't let it work that hard. Make it easy on the liver. And when you do not supply it with a lot of food, it cannot store fat in these amounts. So if you just decrease your food, there will be less fat in your liver. So that's an easy one, right? Just eat less. And actually, we do not need a lot of food for our body. Almost everyone, I'm not sure about you, but most of us have an overconsumption. But especially when you have a fatty liver, at least temporarily until your liver is fixed again, have your plate. Number 2, do not eat after 7 p.m. because digestion follows a circadian rhythm. So when the sun goes down, there's less digestion. So that is the time that the body can repair the liver as well. So the thing is not to eat after 7, but also postpone your breakfast. Eat your breakfast late, because then you make this window wider of repair. Make this window wider of no digestion for easiness on your liver. So after 7 p.m., it's a no-go. And then in the morning, try to push your breakfast as far as you can to give your liver the ability to repair. Third one, refined carbs, like the white carbs of the white bread, the white grains, and especially everything sugar, like the high corn fructose or the table sugars, everything sugar is an absolute no-go. The candy bars, the sugary drinks, the added sugared yogurt, whatever they put sugar in processed foods, stop. Animal products, especially the animal fats, what I'm talking about right now for this particular thing, the fatty liver. Animal fats is a no-go for this time of repair, this time of reversing fatty liver disease. No animal fats. Then maybe you've heard your mother say, everything in moderation. No, not this time. I'm sorry to break it to you, but even small amounts is really hard on the liver. It's like toxins to the liver. So do your liver a favor, please, and just stop for a while with all added sugars, everything sugars that we find everywhere in our food. Even pre-packed dinners contain sugars and, of course, animal fats. So prepare fresh foods, whole foods, fruits, veggies, whole grains, nuts, and avocados. These type of foods are really good, and for some time, no sugars, no animal fat. So then number 4, what should you eat instead? I already said it, the whole foods, the fruits, the veggies, but especially when you take fats, take the fats from nuts and avocados, and the carbs from whole grains and veggies. And these are especially important, the fruits and veggies, because a fatty liver disease is highly related with a disbalance in the microbiome. So we have to feed the microbiome, and we do that with fruits and veggies, especially the fiber in the fruits and veggies. So this is what you have to eat. Number 5, an apple a day. Why an apple? Well, an apple has a lot of benefits also for the microbiome. There's a lot of fiber in it. It is handy for lowering inflammation. There's a lot of antioxidants in an apple, vitamin C. But the thing is that studies show that an apple a day has the similar workings as statins. So it improves your lipid profile, meaning your fat profile, in your liver. So this apple is a real good idea to do. And well, it's quite easy, and an apple is really nice. It's a good snack. It makes a good breakfast. It makes a good lunch, whatever. So you can eat it any time of the day. You can even make a smooth juice. I'm a big fan of smooth juices. That's what I do with a green apple and some ice cubes and water, and blend it with a piece of ginger. We come later to the ginger. So that is a very nice thing to do, but you can also eat just an apple. So that's number 5. Number 6 is lemons. Lemons are detoxifying the liver, and it has a lot of other benefits repairing a fatty liver disease. However, or the damage from fatty liver, these studies are only done on mice so far. However, the people who used the lemon water or the lemon smooth juices really got great benefits, like me, but that is anecdotal. Lemons are known to detoxify the liver for humans, and also are high in vitamin C. So a ton of antioxidants to lower the inflammation. So it's a really good idea to take 1 lemon a day, and take the whole lemon, like you want to take the whole apple, like you want to take the whole everything that is fresh fruit or veggie. So what do? If you have an organic lemon, you can just wash it, and you can also use the peel. It's not what I do, because we do not have a lot of availability of organic lemons. So I peel the yellow off, I cut it off, and then with still the white on the lemon, I put it in the blender with a couple of ice cubes and some water, and that is my postponed breakfast with a cup of coffee or a double espresso, and that is really nice. So that is what I would recommend for your fatty liver: 1 lemon a day. Number 7, ginger has wonderful effects on your liver. So take a piece of ginger root, cut it in small pieces, put it in a cup, and the whole day you can pour hot water on it, and you sip your tea the whole day. And it's really helpful for your liver as well. It works on your inflammation, and that is really treating the causes. So that's important, right? And that's what number 8 does as well. Turmeric. Turmeric is a very powerful antibiotic and anti-inflammatory spice. You can even boost the effect with a little bit of pepper, just a dash of pepper. So and turmeric itself, it is absolutely powerful, but it has little to none flavor. Now, if you really like spices like me, it's a bit of a bummer. But on the other hand, it's almost tasteless, so you can put it on everything, right? With a little bit of pepper. And it really works wonders for everything, but especially if you want to lower your low-grade inflammation. Pour it on everything with a dash of pepper. 9, we already discussed it, but it is so important that I made it a separate point. Eat your fibers, because you have to nurture your microbiome. When you have a fatty liver, it goes hand in hand with a disbalance in your microbiome. And this microbiome is really of vital importance. Without a microbiome, we cannot live. and it's our second immune system. So it's really important that we nurture the microbiome, and we had this whole gut area. It's easy because it's only eating fresh fruits and veggies every day. That's it. And it will absolutely help you with all types of chronic diseases, all of them. So it's a good thing to do anyhow. Then number 10, that has a little bit of a different angle. Meditate. Meditate for a fatty liver. Meditate on a fatty liver. No. We have an old saying here in the Netherlands that when you are really bothered with something or someone, that it gets on your liver. It's like some old wives' tale. And well, there's something in it, right? Like all stresses that we have, they result in low-grade inflammation when those stresses are frequent and for a long time. So we don't have to dig and find out and analyze what stresses we have that may be related to our fatty liver disease. That's way too complex and not really unnecessary. So the thing to do is meditate. Meditation has a lot of benefits, but specifically for this one, it calms your mind and it calms your body so that you do not add to the low-grade inflammation, but you subtract to the low-grade inflammation. And that is really causal. So you do something about the cause. Secondly, meditation in itself lowers blood pressure, which is one of the things that go hand in hand with fatty liver disease. And it also lowers inflammation just by the session itself. Now, one session will not do the job. It's like going to the gym. If you go to the gym for 1 hour every Saturday, well, it's better than nothing, of course. You should do it, but it's way better to have every day like 15 minutes or half an hour of exercise, but then every day. So really regular. And that's the same with meditation. So every day, say 15 minutes of quiet time for yourself. And there are a lot of apps or other YouTubes that you can put on. I also have one on this channel that you can use. That's a 10-minute meditation. But all meditations will do. Maybe you have your own practice, and that's great too. But that is really what I would recommend to do every day for all chronic diseases, but especially today for fatty liver disease. So I hope this was worthwhile for you, and I hope you got something out of it. If so, like and subscribe. And if you want to take it a step further, just check the box below, because often I have free trainings and we can go a little bit deeper because we can have a little bit of a longer time together. So check it out and maybe see you there.